Hi, everyone. Welcome to the Environment Medicine podcast. Today, I am incredibly excited to welcome a truly inspiring guest, Jae Kim. Jae is the founder and president of Hermes Free Telehealth, one of the first national nonprofits to offer free virtual medical appointments to anybody in need. Under his leadership, Jae has been able to provide over 1,200 months of free mental health appointments in 2023 alone. He was able to partner with organizations like BetterHelp, Teladoc, and even the Texas Department of State Health Services, and even earned a nomination for the 2024 Nobel Peace Prize. In addition to his work with Hermes, Jae is also the founder and executive director of the Silvergrass Institute, a biology education nonprofit that has reached over 1.1 million students across 65 different countries and is being used by hundreds of schools worldwide. Additionally, Jae taught a course at Rice University titled Planetary Health: How to Save the Environment and Ourselves, where he led conversations from environmental justice to indigenous knowledge. And as if that weren't impressive enough, Jae was also recently selected as one of just 32 U.S. Rhodes Scholars, earning a fully funded postgraduate education to Oxford University. I hope you guys enjoy.
Yeah, thank you for inviting me. My name is Jae Kim. I am, like you said, recently graduated from Rice University with, I studied biology and minored in environmental studies. And yeah, after college, I'm doing my master's in the UK as a Rhodes Scholar. Then I plan on returning to the US to pursue med school, and eventually, like in the grand, eventually in my life, I want to be like a physician, but more of what I call a physician advocate. So less so just treating individual patients and individual illnesses, but really looking at things more holistically and understanding how, the natural and built environments around us affect people's health. So really want to like work on like the environment health nexus in the future. But yeah, I think that's like a brief introduction.
Yeah, thank you so much for that. And I think your plans for the future are really inspiring. But let's start from the very beginning. I saw that you moved from South Korea to the US. How do you think that move kind of influenced your early life and what your passions are today?
I think like I remember, I don't remember too much about living in South Korea because I moved here when I was 10. But one of like my most prominent like memories from South Korea is I lived like next to like the largest river in South Korea. It's called the Han River. Every time it rained, the river would flood, and like you just see like fish swimming out. I walk outside of my apartment and there's fish swimming there. That's how severely it flooded, and there would be like landslides. So I remember like, I mean, back then obviously I knew nothing about climate change, and it was just funny to me that that amount of flooding would happen. But like thinking back, I like drawing connections to how like climate impacts. Like I was able to observe climate impacts even back then. And then when I moved to the US, I moved to New York City, which is also like a very urban place that is very affected by climate health hazards. So New York also floods a lot. It gets very hot there now. Air quality issues. And then I went to school in Houston, which is like oil and gas capital of the world, and really one of the least environmentally just cities in the US. So I think like the three cities, like all very large cities that I've lived in, really allowed me to witness firsthand how climate change and environmental degradation can affect human health. So I think that like shaped my passion for what I want to do, because it was never abstract for me. Like whatever I read about, whatever I learn about, I've seen in the cities I've lived in.
Yeah, I completely agree with you. I'm also based in the Houston area, so that was definitely something I can relate to. But later in your life, you kind of also developed a passion for health as well. And you came up with the idea to create the Hermes Free Telehealth. Can you tell me more about that?
Yeah, I think like when I came into college, I was like very confused on what I wanted to study. Like I've always been passionate about like conservation, like animals, saving the polar bears, like recycling, all of the classic like environmental things that I think like younger people care about. But I never like connected that to a career in my mind. That was always like a hobby, like a passion and interest. So I like came into college wanting to study like medicine, medical technology. And yeah, I think like about like a year or two into college, I realized that like the two interests that I have, like two very strong interests, one in like human health and the other in climate change and environmental work, like they don't have to exist in separate spheres. Like I realized that they're like, it's like reconcilable, because at the end of the day, like both of them are about like protecting life, whether you're like treating patients, working on population health, or you're like trying to mitigate the effects of climate change or pollution. What you're trying to achieve is the same. So I think that's when I realized environmental health is where I want to work in, which combines the two passions that I had. And at the time, like this was like, I guess like towards like the tail end of COVID, and also after Hurricane Harvey in Houston. So like the effects of Hurricane Harvey were still like observable and very present. So I was always a big believer in like experiential learning. So just doing things outside of the classroom, like more hands-on experiences. So I was like, how can I take like my first steps into environmental health? And I thought like one great way to do it would be through like telemedicine, since like one of the biggest like challenges that happen after natural disasters is that people's access to healthcare gets cut off. So and then COVID showed us that like telemedicine is a really viable option, and COVID also really opened people up to like doing things virtually. Like pre-COVID, no one knew how to do Skype meetings, Zoom meetings, online calls. But after COVID, seniors and like children know how to do meetings and appointments virtually. So I kind of like connected the dots and created a nonprofit that provides free telemedicine to any individuals after natural disasters, regardless of like income, documentation status. And the scope kind of evolved eventually. So it was really just anyone that is facing barriers to healthcare, not necessarily just like victims of natural disasters. But yeah, that's how it came to be started.
That's really cool, actually. And later on, you also kind of developed an interest in policymaking, is what I can see, right? Can you tell us more about that as well?
Mm-hmm. I like came into college with like science, and I wanted to like my first research experience was creating like bacterial biosensors for sustainable industrial production. It sounds like super complicated, but it really isn't, where you just get like a large tub of bacteria and you like genetically engineer them so that they produce chemicals that you want, they produce like medicine that you want. So and that's the bacteria. Yeah, and that's just like way more sustainable than how a lot of industrially relevant chemicals are produced now. So I like worked a lot in like the more like engineering science side of climate change and sustainability. And I think as I progressed through college, I like realized that these breaking edge like technological solutions to climate change are very important. But in my mind, like I was just thinking, and I was like, if I was like supreme leader of all of the entire world tomorrow, with the technology that I have, could I fix is a bad word, but could I reverse climate change, and could I get us back to a safe level of planetary existence? And the answer is yes. Like we already have all of the renewable energy technology we need for the fossil fuel transition. We know that like, meat consumption, if we reduce that, we know how to do agriculture more sustainably. So yeah, it's just like we already have all the scientific answers that are enough to address the challenges that we have. So I didn't really feel like my place was like in science at like, keep pushing the boundaries of the technology that we have. So I think that's when I tilted more towards policy. Like we have these solutions, we have this technology. Why aren't they being implemented? Why don't people know about them? Why don't people care about them? So I think that's when I made the transition. I feel like your question kind of got lost, but
no, but I'm actually kind of curious about this. Do you think, like you were saying, how we have enough technology to kind of reverse whatever damages we have done? Do you think that there's just been a lack of communication between like the scientific worlds and the policy worlds, and like that's what our main issue is?
I think not to go from like 0 to 100, like yeah, I think that's a very prominent part of it. A lot of like, not just in like environmental science and climate science, but a lot of scientists are just in their ivory tower, like they produce paper after paper with like amazing data, amazing science, high quality publications, but they don't follow through. How is the science that I'm producing becoming policy? How is the science that I'm producing becoming practice? So yeah, I think part of it is like science communication, where scientists are not communicating it. But I think like especially for like environmental and climate solutions, a large part of it is also just like, it's just dark influences, where even if scientists produce excellent solutions that are cost effective, better for society, like long-term solutions, like, and even if they were to communicate that like excellently to policymakers, if the policymakers have alternate interests driven by like more powerful, wealthier people in society, that's just not going to happen. So I think there's like two sides to it. There is a lack of science communication from scientists, but also it's like you can't not acknowledge the fact that like there are like people, there are like darker forces that do not want all the science becoming policy, becoming practice.
Yeah, I completely can see both sides of that. But can you tell us more also about your work at the Stockholm Environment Institute as well?
Yeah, it's just I wanted to like I thought that a lot of the work I've done in like environmental health, climate health was very like siloed in the US, but that these are like problems and also solutions that far exceed one nation. So I just wanted to get a little bit of an international experience. So I'm interning with the Stockholm Environment Institute this summer. They're based in Stockholm, but they have like branches across the world. So kind of a misleading name if you think about it, but they're like the headquarters in Stockholm, but they have offices in like Asia, Africa, and like in other parts of Europe. So like an organization with an international reach. And I'm studying how like building supply chain resilience in face of climate change. It's like a way to break it down is as climate change happens, it worsens like health issues, like it causes cancer, it causes respiratory issues, it causes like heat illnesses, it causes mental health issues. And as you increase the rate of these illnesses, the demand for the medicine also goes up. Like albuterol and like antibiotics, antivirals, and like medical supplies. So all this demand is going up. But another thing that climate change is doing is that it like disrupts supply chains, like flooding, sea level rise, like extreme heat, making it so that workers can't work as effectively or as much. Like it disrupts the supply chains for this medicine. So just looking at how this is like a very disruptive cycle where the demand for all these medicines is increasing because of climate change, but the supply of these medicines is decreasing because of climate change. So that's what I'm working on right now.
That's really interesting, actually. And was that kind of the reason why you also wanted to go to Oxford for that more like international experience?
Yeah, for sure. I knew that I wanted to go to med school because just based on a lot of the things I've seen, yeah, I haven't worked in medicine, but like physicians have like a very clear platform in society, especially when it comes to like health related issues. So I knew that like the change I wanted to create would best be created as a physician, especially considering that like a lot of the leaders in like the climate health and like planetary health spaces have a physician background. So I knew that I wanted to go to med school, and yeah, I knew that I wanted to go to med school, but also the way that like the medical school curriculum is set up, it doesn't focus a lot on like social determinants of health. It doesn't focus on like really the granular aspects of like climate change and like climate impacts on society that I wanted to learn about. Also, it doesn't teach you about policy because that's not. Should all doctors be very acute, but have a very acute knowledge of policy? Yes, but that's not how our medical education system is set up. So I knew that I wanted to do something between college and med school to supplement what I wouldn't learn in med school. So I was just looking at a bunch of different opportunities, applied to like an ungodly amount of like fellowships and scholarships. I feel like for a lot of them, it's just like, so competitive that I just like spread my net really wide. So, but all of them are international because like you said, I wanted to get an international perspective. So I applied for like a bunch of like Rhodes, Marshall, like a lot of like degree granting scholarships, but I also applied to Fulbright and like, more research focused scholarships. So and then one of them worked out. So, and I really only needed one of them to work out, and thankfully it did.
Yeah, and congratulations on getting the Rhodes Scholarship. That's a great achievement.
Thank you.
Yeah, and also you did also discuss how like medical school requirements didn't really focus too much on the policy aspect, the social aspect as well. Was that kind of your motivation to start the Planetary Health course at Rice?
I think Rice University was just like lacking in a lot of the environmental courses that I wanted. Like we have an environmental science major, but it's always like like ocean, like oceans and like like geological mapping, like climate dynamics, like all super important stuff. But like I said, like that is not the part of climate change I wanted to study. Like I feel like to pursue the climate solutions that we need to save ourselves, really we only need like 2 sentences of science. Like humans are increasing greenhouse gas emissions. Greenhouse gas emissions are warming the planet. Like to me, like that was enough science. So like all these courses were being offered, but that was not what I wanted to study. I wanted to focus on like climate impacts on society and like political, economic, social solutions to climate change. And there weren't a lot of courses on that at all, if any. So for me, it had to be a lot of like self-studying. I read textbooks. I did internships. I like reached out to professors at other universities working in this field. Going into my senior year, I thought like there's got to be other people at Rice that are interested in like climate and society, in climate health. And I just wanted them to have like an easier introduction to the field than just starting from scratch. So it wasn't like a huge course. once a week course, so very like low commitment course, but I think it helped a lot of like underclassmen just like set foot into the field. I'm sure they'll like carry it on and like find their niches within it.
Yeah.
During the rest of their time in college.
Yeah, that's really cool as well. And how do you think we can make this information more accessible to just like the general public and not just limited to the people at Rice?
I think like to me it like doesn't like making the information more accessible isn't like the biggest like priority because you know most like young people in the US and probably in the world like know that climate change is happening, know that it's probably not a good thing. So I think the bigger question probably is like how do we like motivate people to take action, and also like what is the right way to take action, because you know it's just like I think it's a very delicate balancing of like individual responsibility and like you know collective and the corporate responsibility. Like are corporations causing probably all of this? Yes, but is it productive to just be like I will live however I want, I'll save my time on like advocacy and like getting involved, activism, all of that because I'm not the perpetrator? That's you know obviously not productive. But also should we be like calculating our carbon footprints, like blaming each other for like eating meat, like driving cars? Like of course not, because that is such a small part of the problem. So I think like the delicate balancing of what action should we be taking ourselves, and but also how do we realize that the picture is so much greater than our individual actions. So I think like kind of there's no answer to that, but making people more aware of that dichotomy I think is super important, because I think just making people more aware of the fact that like we need both individual action and also like pursuing more systems level change. Corporate responsibility. So making people aware that both are important, I think is more important than like just like informing people about climate change, because I feel like it's such a prevalent issue and people see like natural disasters and people read the news. So like the facts are there. So just getting people to care and act, I think, is the bigger part.
Yeah, I completely agree. What would you kind of advise to the youth that are stepping into this field of environmental health? Like what would you say? What would you advise them to act on? Maybe educate themselves about?
I think like one of like the biggest things is just like to not be discouraged. I feel like I like struggle with this a lot too, where it's like you just like think and it's like this is like climate change has existed. Like just talking about climate change, even though like there's a bunch of other environmental issues that are tangentially related, but climate change has existed since like 1980s, 1990s. It's probably been really serious since the start of the 21st century. There's been probably like hundreds of thousands of like activists, scholars, politicians, like advocates, whatever, working on this issue. And then we see news headlines like world reaches 1.5 degrees for the first time. Like a study shows that there has been zero climate progress in the past 15 years. So I think it can be a little discouraging, but just like recognizing the urgency of the moment, where it's like we're definitely not the generation that will face the worst of the climate crisis. Like we'll probably be long dead by then, but also I think it's like not an exaggeration to say that we're probably the last generation that can stop like irreversible damages, which at this point I don't even know how true that is, because keep like conflicting sciences. I think like the variability and the uncertainty is just like such a fundamental part of climate science. No one can say for sure, but it's clear that ever since like a couple of years ago, we have been in the tipping point where if we go any past this, it could really cause like ecological collapse. So not being discouraged and recognizing that you are living in a very crucial time period. So taking advantage of that. And then I think that's the biggest thing. And also another thing is another thing that I think is hugely important, I guess advice if you were to call it that, is just recognizing the interconnectedness of like environmentalism with like other causes. I think that it like environmentalism that doesn't consider and doesn't acknowledge like racism, like extractive capitalism, colonialism, like classism, that's just recycling. That's just like tree hugging, because the oppressive systems and the people in power underlying all these systems and also driving the climate collapse, it's the same people. So you just really need to dig a little bit deeper to find out like all the issues are interconnected. So I think that just making sure that you're not only an environmental advocate, only a climate advocate, because like really again, that goes back to the question of like individual like action versus like systems change and like collective responsibility, where you can be a climate advocate, tell people to like eat less meat, help like do like recycling campaigns, things like that. But then you're only doing the two sides need to coexist. But if you're only focusing on environment and climate change, you'd only be doing the individual responsibility side, which quite frankly is the less important side. So really understanding that like, yeah, for us to have like really meaningful systems change and yeah, make progress on climate issues, we need to acknowledge that like, yeah, yeah, there's other systems of oppression and other areas of activism and yeah, other areas of society that we need to like collaborate with and care about. So, yeah, I guess one TLDR, one super short way to say it is making sure your climate work is intersectional, because I think otherwise it means very little and it achieves very little.
Yeah, those are some great words of advice. I know we're running a little bit out of time with the meeting, but thank you so much for coming. I really appreciate your time. It was wonderful speaking with you.
But yeah, also I guess to you and also anyone that might be watching, like I'm sure like you'll link something that people can reach out to me with. But yeah, definitely never hesitate to like reach out to me if you have any questions, if you want any advice, like opportunities, things like that. I feel like I did so much like cold emailing when I was like starting college, and even now I message people with like 100,000 followers on Instagram, like and like LinkedIn, like all the time, like asking them to meet, as like asking them to discuss certain topics, collaborate. So yeah, definitely never hesitate to reach out.
Of course, yeah, thank you. I mean, that's basically how I reached out to you, but yeah, thank you for that. And that's it for today's episode. Thanks so much for hanging out with us. If you like what you heard, be sure to subscribe, like, and leave a comment. If you'd like more, please check out our other episodes and follow us on our Instagram page at Environment Medicine to stay in the loop. See you next time on Environment Medicine.